we just finished up with the 12-year-old checkup, and after the 12-year-old visit, there's a couple things that I want to address with you guys that we may not have had enough time to spend talking about in the office. Remember, share these videos with people that weren't able to make it with you to the appointment, and then also, just kind of think about some of the things that we're going to bring up here on the video today. So at 12, okay, we're in middle school, routine, life, everything is a little bit different. And depending on where your child falls in the age of puberty and things like that, there could be a lot of things going on, or we still may feel like the little kid running around with the big kids at school. That's a pretty normal thing. So especially like with boys, it does seem like boys develop a little bit slower with this stuff. They enter 6th grade as a kid, and they go out of 8th grade, with a beard and a mustache or something like that. So those changes come, and if they aren't coming, that's okay. Puberty changes can take some time. With girls, early puberty development and stuff like that is going on right about now. Some girls are further along than other girls. That's a normal kind of thing too. But around the period time, remember, if your periods are starting to get to the point that they're so heavy or crampy that you're missing out on school or activities, those are all things that we need to know about. Just knowing that your periods can be irregular the first couple of years of life too. So let us know, talk about that stuff. I don't know if you've noticed this, but I'm a boy, okay? And so we tell girls this, that if there's a problem with your periods or something like that, the vast majority of the time it's talking and no touching, looking, things like that. But if we do get to the point that we need something, we'd be happy to check them out. If not, we have lots of friends who are girls, girl gynecologists that'd be happy to see you guys, fine too. But most of the time we just talk and that's it. When it comes to boys, this is also one of the ages that we start doing the boy checks and check and make sure everything is okay down there. The first couple times we'll do it in the room with you guys if your kid's comfortable with that. If they would rather do it with just alone in the other room, we're okay with that too. But a lot of times at this age, we just do it with the parents and everyone looks away, and it's super awkward for everybody, and then it's over with. And that's the way it goes. Okay, so now that we're 12, okay, there's something that's really neat that happens at this age with your development, social and emotionally. So before this, we talked about when they were younger, that you are, that it's your friend group and your peer group, managing friends, forming friends, things like that. And then as they get a little bit older, it is, developing who they are, and how they feel comfortable with what they're good at. I'm good at school, I'm good at sports, I'm good at this, whatever. And then we even talked a little bit about forming the family unit or the family relationships and stuff like that. Those things should be growing more. And at this age, you should be able to have a discussion about, where do they feel like they're it's kind of hard to say, like the good in them fits in part of the world. Okay, so think of it this way, what are they doing that's good for their community? Okay, are they a good neighbor? Are they a good friend? Are they good with playing with the other kids in the community and keeping people out of trouble? Are they a good friend where they can talk and have good discussions with folks about things? Maybe not so much. If you're part of a youth group or sports, or whatever, being a good teammate, things like that, and then cooperating with a family is a big deal. They should feel, their worth within your family. So talk about those things and strategize on how you can, formulate a plan so that they can feel like they're part of the family, because they are, okay? They're not just some bump on a log sitting up there playing Xbox the whole time. No, they shouldn't be. Hopefully they're still doing that around you guys and that you're engaging each other in conversation. So it's a cool thing to think about. And compassion and empathy, those are things that you should be feeling in them. And if not, have a discussion with them about it. Say, you know what, I notice that you don't really seem to care what other people are doing or thinking or things like that. And just see, maybe they just don't know how to express it, because it is weird to feel that way and express that if you've never really, if you're not a natural, empath with those kinds of things. Okay, and then responsibility is a big deal at this point. They should be able to take responsibility for their schoolwork and their routine and their schedule and things like that. So yeah, work on it with them and say, yep, so you should be getting your work done. And so it's not like you're not micromanaging it, but you're definitely confirming and checking that, yep, that was done. And you can, as you get better, you can do less of that. Some kids need a whole lot of checking at this point. Some kids need very little of it. But still check in with them. Make sure that they know that you care, that they finish their, math homework or their band practice or things like that. Okay, at 12, couple little things. If we see acne on your kid, I'll bring it up. So we'll tell you, say, hey, I don't know if you noticed this, but you have some acne. Does it bother you? Now, my personal feelings on the acne thing is everybody tells me that it doesn't bother them. I completely disagree with that. Okay, I remember, having acne issues at this age and older and stuff like that. And I remember it bothered me and I didn't want to tell anybody. Maybe there's those kids that it really doesn't bother them. Okay, sure, but I still don't believe them. So if they want acne medicine, we can help you out. If or a lot of times mom bothers them about it, say, man, you don't wash your face more than or grandma does, then we'll give you acne medicine. That's totally fine. A lot of times the prescription medicines that we give are cheaper and more effective than some of the fancy over-the-counter stuff that you buy. So when it comes to acne medicines, there's nothing wrong with us, the adults, putting the acne medicine on our kid's face. Check in at nighttime. Okay, I'll put it on you. Okay, and then we can go from there. The biggest reason why acne medicines don't work is because they're not being used. So yeah, that's part of your check-in process at night. I'll put your acne medicine on for you. You're just making sure it's actually getting done. Okay, and then at this age, you should be having, and hopefully you have before this point too, discussions with your kids about drugs and safety around those kinds of things as well. There's just no reason for that stuff, and hopefully you're modeling that behavior as well. So talk to them about it. Say, what do you do if this comes up? I feel so kind of convicted about this. I mean, we didn't talk about it so much that they were expecting it, but I remember talking to my oldest when she was getting out of 6th grade, and she says, can you believe it? Nobody offered me drugs the whole year. And I said, well, that's great, and she says, but you would bring it up like it was going to happen. I said, dude, I was joking with you about it partially, but I guess me checking up on him and being like, hey, picked you up from school today. Hey, did anybody offer you drugs? I was joking. I didn't really think she didn't pick up on it. And sometimes my jokes fall really flat, but it's a way for us to engage and have a discussion about it. And so have those discussions now because we want to intervene later on. And then the other thing is dating, things like that, are something that hopefully we're not dealing with at this age. I think it was really strange when my 6th graders started talking about coupling, okay, that there were couples in the school. What does that mean? Well, they're a couple. Well, what does that mean? And none of her friends would give me a good answer about that either, no matter how funny I was about this. But, but the thing is that the purpose of dating, man, you guys know this, right? No one's getting married at 12, hopefully no one's having babies at this point. So what, I guess you can call me a little bit of a Puritan about this, or having really conservative values on these things. I have no problem with that. I have no problem with telling my kids, hey, look, there's no reason for you to be dating or things like that until you turn 16. And besides, what are you gonna do? You're gonna take a 12-year-old to a movie and, things like that and be alone? I just don't think it's necessary. So how about this? We're all friends. We can be friends and we can learn how to navigate those kinds of relationships before anything starts to get sexual, okay? But there is no reason why any couple or any other boy-girl pairs or whatever should be spending time alone, period. That's just the bottom line, okay? I have friends who their kids have gotten pregnant when they were 14, 15 years old and stuff like that. And I've asked dads, I've said, Dad, what would you have done differently, looking back? And the one thing that I hear a lot is having frequent, frank conversations about these things. And then the other part too is the supervision part of it, okay? We control where our kids go at this age, okay? So we should be able to say, no, I don't think it's really necessary for you to be alone with, these girls or these boys or things like that. Because there's some pretty serious consequences that are going to change all kinds of things if these things happen. So how your family handles it, it's up to you guys, okay? But have the discussion, okay? We don't want to get blindsided by any of these things, and it's perfectly fine to tell them, this is what we think about, this is what our family thinks, okay? Why is it important, okay? Because you don't need a baby. You don't need an infection, okay? You don't need to be 13 and have herpes, okay? So, but again, those are things. So talk to me if you have questions about these things, but talk to your kids, and these should be frequent conversations. There's nothing wrong with you're in the car driving to baseball. Hey, here's a question for you. What do you think about this? Or I heard about this friend who had this happen to them. Do you think that could ever happen to you? Throw it out there, have a good time with it. And I think you'll enjoy the relationship that you're developing with your kids. Okay, so the next time we see you guys is next year, okay? And if anything comes up, you have questions, please let us know. But we'll see you at 13, okay? Have a nice day, guys.